Did you know that almost half of women over the age of 20 are living with some form of cardiovascular disease? With that in mind, if a woman goes into an emergency department with any sort of symptoms of a heart attack or heart condition, they are statistically likely to wait 11 minutes more than a man with the same symptoms. Heart disease is the leading cause of demise for women, impacting 1 in 5 women each year. It accounts for 1 in 3 maternal passings. Yet it wasn't until 1999 that the first journal by the American Heart Association was written with a focus on heart disease in women. In 2020, 1% of healthcare research was invested into female-specific conditions. What do we do about this, ladies? We have to advocate for ourselves. Heart disease can mean many different things. Coronary artery disease is the most common in the US. Cardiovascular disease can look different for many different people. It can look like heart palpitations, chest pain, pain in the neck, jaw, and throat, shortness of breath, nausea and vomiting, new and sudden onset of sweating. As women, we must have an understanding what these signs and symptoms are, how much of a risk we have of cardiovascular disease, and start working to advocate from a very young age. It starts with the obvious, your diet, exercise, etc. But as you are having symptoms, no matter what age you are, it can be anything from feeling palpitations, having the shortness of breath. When you stand up, do you get short of breath? Do you get lightheaded? All of those things, and you document them. Dates and times and what the symptoms are. Know your irregular heart rate and blood pressure so you can track it and know your baseline and be able to give that information to a doctor if you go in. So many times we try to talk to doctors about things and we are pushed aside because we are women and it's anxiety, or we need to get more sleep. We have to take our health into our own hands. Advocating for yourself starts with documenting your symptoms and ensuring that when you go in, you do not allow them to push you aside. You come in with objective information, and you do this at a younger age than you think. Knowing your baseline heart rate and blood pressure and all of that seems like something like a really good idea as you age, but absolutely not. This starts when you are young. Put in the comments any specific questions you have and follow me for more healthcare tips.